Hi guys, my name is Tanesh and I would like to show you how to do the procedure for arterial puncture. First of all, I have to prepare the things, which is the needle with the syringe, and then we will be needing micropore and heparin to prevent hemolysis. And then we will be needing gauze. I'm using gauze instead of cotton ball because gauze give more pressure compared to cotton balls. And then we will be needing 2 alcohol swab. One is to use for the patient's hand before the procedure. Another one is for the heparin. And then we have to prepare the padding to make the patient comfortable, and also the consent form in the specimen bag here. Alright, so before I start with the procedure, I would like to wash my hand and also use the method of nothing below the elbow. And make sure I have to cover my hand washing method until my my arms. So I'll be using glove to prevent infection. Before I start with the procedure with the patient, I would like to use the heparin first, which is to prevent hemolysis. Before using it, we have to ensure to sanitize it with the alcohol swab. So before doing the procedure and so on, you have to ensure you check the consent form from the patient to make sure you do the procedure for the right person. Alright, so hi sir, may I know what's your name? Alright, so Mr. Magin, I am Danesh and I'll be the phlebotomist for you today, and I would like to do the arterial puncture for you, and I hope you are fine with it. Okay, so before I start with the procedure, I have to put the padding under the patient's hand, the wrist, to ensure the patient is feeling comfortable, and also I find to make myself easier to find the vein, artery. Alright, so first of all, we have to check for the arterial. I have to check for the arterial pulse. Once I have checked with the arterial pulse, what I have to do is disinfect the patient's hand before start with the procedure to ensure we prevent from infection and so on. Once I'm done with the alcohol swab, I have to wait until it dries. And I have to ensure I hold the patient's hand leaning down to find for the artery. And I'm using the method of 45 degrees instead of 90. And I have to give pressure to the patient's hand to prevent bleeding and so on. And we have to ensure we give the pressure for like 3 minutes at least. It's either I can hold for the patient or I can ask the patient to hold it for themselves. I'm using 2 layers just in case. Okay, so with the specimen here, what I'm going to do, I'm going to make sure to put ice cubes inside the specimen bag, and then I'm going to put this sample inside.
Okay.
So once I'm done with the micropore, I'm going to take the specimen and I'm going to make sure to put ice cubes inside the specimen bag before I put the sample inside. So I'm going to put the sample inside along with the ice cubes, seal it properly, and then send it to the lab together with the consent form. Alright, that's all. Thank you.